Good morning, everyone. I'd like to preface my presentation by saying it's an interesting place to be in Montgomery having the conversations that we're having today. I had the fortune of having a taxi cab driver whose wife was on the march to Selma, and hearing that story as I'm coming in from the airport and prefacing this presentation was just beyond powerful. So thank you for bringing us to a place where this may be more, it has more historical perspective than other regions, I would say. So looking at Appalachian Community Fund, we're very similar in the makeup to Black Belt Foundation in the fact that we believe in community change starting with the community. Our mission is to work to build a sustainable base of resources to support community-led organizations seeking to overcome and address issues of race, economic status, gender, sexual identity, and disability. So that's quite a gambit. You can probably tell that we work with organizations from, anywhere from senior centers to youth, lesbian, gay, LGBTQ issues to race. But our journey to justice, our vision, encompasses an economy that is strong, stable, provides diverse employment opportunities for all people, a place where government and industry are accountable, that's very important, accountable to human needs without exploitation of people and their health, and also where wealth and resources are shared equally. And I do have kind of a concern in our vision that we look at equality versus equity, and I'm going to get into that a little bit towards the middle of our presentation on why it's so important to me and our fund to share resources equitably. So looking at specifically consequences of rurality and race in Appalachia, how many of you are familiar with the struggles of the coal industry in Central Appalachia? More hands than I expected. We are a quiet place. We tend to get overlooked in terms of those types of disparities, but there's a long history in Central Appalachia when it comes to corruption in local government and lagging public policy. A lot of that has to do with the low wealth individuals that are in place in our region. And women and people of color are often discouraged or excluded from civic activism. That has a strong tie to the coal industry and timber industry. If you look at those blue-collar jobs, you have quite a dichotomy between the ownership and the workers, and then you also have quite a dichotomy between the blue-collar workers and the females in that community in terms of the roles and responsibilities of those individuals. So racism poses a very unique obstacle for us, not only at a governmental and policy level, but also on the ability of groups to organize, both within our communities and with each other in a broader sense of social change in that movement. So what that means is through these exploitive industries, we've created pockets within our communities, some based on race, others based on culture, and when those start to intersect, it's butting heads. It's not working together. We see a lot of differences in one another versus the things that we have in common as a community. So looking at this, not necessarily from just a micro perspective, but also a larger level perspective, racism in the United States exists, even in communities and institutions where people of color may not physically be present. I grew up in a town that has 2% minorities. I was completely dumbfounded when I got out of my community to experience that type of presence. And when we look at that, again, from a larger perspective, we are forgetting people within those communities. So as an organization, Appalachian Community Fund really seeks to find the people who have been either forgotten or lost in the system and empower those people to make change and make their communities what they want them to be. The biggest struggle from my perspective in kind of targeting this rurality and race issue is that it's communicated, racism is communicated powerfully and often very subtly in society. So, for example, in elementary school, we never talked about Black history. That's wild. You're completely forgetting an entire population of people and only choosing to focus on things that are quote-unquote relevant to that population. Those types of things don't necessarily come off to an elementary student as race issues or racism, but if you have that compounded over 20 or 12 plus years, it's going to really create some huge shifts in the community and how we view ourselves as a community. So looking at consequences of poverty and economic divestment kind of layered on top of those issues of race, we know that those in poverty engage in poorer health behaviors, and this kind of goes off of what Michael was talking about earlier in those maps that you saw. So if we're looking at social determinants of health and how poverty plays in, you're going to see that things of socioeconomic value, things like education, employment, income, family, social support, and community safety, make up about 40% of someone's overall idea of health. Those are the hardest things to change, right? Behaviors are very, well, I shouldn't say behaviors are very easy to change. Those of you in the medical field would disagree. But they're easier to change than someone's job status or someone's educational attainment. And so what we hear, and this is a direct quote from a provider in Appalachia, the patients don't have a sense of responsibility to themselves, and they don't have a responsibility to the doctor. And what I would pose as a question and a challenge to you all that are kind of pondering this is, if I have an overwhelming sense of defeat in 40% of my outcome, what is that going to make me? It's going to make me feel defeated. I'm not even going to try. And that's what we're seeing with patients. They say, oh, well, you know, it really stinks that I have cancer, but I'm also taking care of my grandchild, and my daughter is in rehab, and she's pregnant again, and how do I mitigate all of these factors? So we're seeing that patients aren't taking responsibility for themselves, and they also aren't really following the instruction of their doctors because they have higher level issues to consider. What we hear from patients is that the doctors are frustrated because the patients aren't following their instructions. They forget to come back, and they show up in a worse condition than they came to begin with. Again, taking into play those social factors, if nothing is getting better, if everything continues to add on to me and I'm stressed and I can't provide for my family and I feel no sense of connection, I'm going to be more likely to give up. So we definitely have this deterministic factor in Appalachia where people are predetermined, whether they think that or not, to give up before they even start. And that's a really hard playing field for fighting for social justice. So we take into account those non-biological factors and how they contribute more to health and disease. These are those social determinants of health that you've been hearing about all morning. And these are conditions in which people are born, grow, work, live, age, and the wider sets of forces and systems shaping the conditions of their daily life. So this is their social being, everything that encompasses them as an individual. Social determinants of health are mostly responsible for health inequities. The unfair and avoidable differences in health status is seen within and between countries. So we can look at this as a global issue. We can hone it in as a national issue, regional, state, as far down as you want to go. But the bottom line is those social determinants of health are really what's shaping the state of healthcare as it is now. Economic policies and systems, development agendas, social norms, social policies, and political systems also play a large part in shaping those differences. So with the Appalachian Community Fund, oppression and racism informs our work really in all of our activities. Our goals and our outcomes also seek to model an organization which is effective, responsible, accountable, democratic, anti-racist, and committed to developing leadership. Racism does pose a unique obstacle to the ability of our groups, as I mentioned earlier, to organize. And history shows us, and it has been discussed today, that racism is consciously and systematically erected in our social structures. So it's been used intentionally to manipulate and destroy movements for progressive social change in this country. In addition, we also feel that the methods that we use to unlearn racism can also be applied to other isms, sexism, ageism, those types of things. We understand, and it has already been alluded to as well, that white Appalachians, while not feeling privileged, unknowingly benefit from those racist institutions that exist, even while condemning a system known to be unfair, unjust, and oppressive. So that goes back a little bit to our history and our culture. We are, I hate to overgeneralize too much, but we're kind of oppressed by nature in Appalachia. And so when you add on to that other things that break apart the community, it really starts to add up to the fact where, yes, we have this issue of race, but we also have an issue of race that people don't know exist because they're already oppressed, so who has it worse than they do, right? And that type of mentality and that type of attitude is very, very dangerous when you're talking about communities because it leads to even more oppression. So we feel that Appalachian Community Fund feels that in order for any of our organizations to be allies in the movement that we're trying to create, we have to be willing to work cooperatively and respectfully with each other, to be accountable for our behaviors with our allies. And how we do that is we have a lot of regional and state meetings with our grantees, where we sit down with them and not only talk about the work that they're doing, but also just how they're feeling in general. Excuse me. We try to capture brief essence of needs assessment in those meetings, where and again, we're not necessarily just talking business about their programs. We want to know how they're doing as people. And that helps us be accountable for our actions, because we're not basing our work on what we feel like the problems are. We're basing our work off of the complaints of the people in our communities. So this is a really nice visual of what I was talking about in terms of equality versus equity. In Appalachian Community Fund's work, we're not necessarily looking at equality. We want to get everyone to the same advantagement. We want everyone to have the same opportunities. And that may mean giving a little bit more to certain groups than others, but that's okay because it kind of all evens out in the wash, is how we look at it. We typically fund folks who come to us. We don't do a lot of reach out at this point, but this is our 30th year. This is our 30th anniversary. Actually, June is our 30th anniversary. And we're looking at doing a more meta-analysis of that needs assessment, trying to go out into our communities and say, hey, we know this problem exists, so you tell me what's going to work to fix it. And if we're on board as a group, the money's yours to go after it. So we do a lot in terms of coalition building, community organizing, community education, training, cultural work, and advocacy. We also provide grants to community-based organizations working to end racism, promote nonviolent communities, and build organizations that are fair, inclusive, and democratic. So racism is central to our mission and vision, and looking at some of the highlights that Appalachian Community Fund has received over the years, we reached 5,000 undocumented immigrants in Tennessee with information about administrative relief to avoid deportation. We connected chemical safety with racial justice in order to develop strategies to address the disproportionate impact of chemical releases. We challenged and postponed a road project which would have destroyed Chattanooga's historic African-American Lincoln Park neighborhood with its old Negro League ball fields. That one was a huge success. We examined with an interracial group of middle school students the effect of urban renewal, gentrification, structural racism, and classism in their own backyards. That one was really fun too. Some of the bigger projects that we have done include these larger organizations in Tennessee. Centro Hispano is a nonprofit organization and welcome center for multicultural families of East Tennessee. It provides them a welcoming, open community, which can be kind of hard to establish in a predominantly white area. We do have a lot of Hispanic populations coming into East Tennessee, predominantly in farming and factory industry. So we're trying to serve as a source of essential information as well as a gathering place for those folks to feel welcome in our community. Chattanooga Organized for Action is a very large organization in itself. They work to initiate, support, and connect popular grassroots organizations within their area for the purposes of advancing local social justice. They have a large play in terms of housing, gentrification, and politics in Hamilton County. The Unique Academy is a rites of passage program that's dedicated to transforming African American youth to respectful and respectable African American adults. Unique is an acronym that encompasses 5 of the 7 principles of Kwanzaa, and they meet weekly. Transportation as well as meals are included to help establish those roots of community change in the youth that are available in that area. The University of Wisconsin Population Health Institute has a really great map, I would say, for looking at county health rankings and roadmaps to success for rural areas. And I wanted to highlight some of the ways that not only Appalachian Community Fund, but East Tennessee State University are doing, some of the things that they're doing to expand that higher education, provide service learning, and those types of things. One thing I would like to highlight here is, as was mentioned earlier, the Nurse Family Partnership Program. This is a program that allows first-time mothers access to home visits from nurses, as well as kind of a mentor in that community health nurse. We've had some really interesting data come out of our first go-round with that program. What we're seeing is it's dramatically successful for first-time mothers with addiction issues. It's also very useful and beneficial for mothers with lower educational attainment. So providing those strategies for newborns and mothers to those newborns in follow-up for like 6 months and a year, that's providing us with some really good parental skills for people that would have not had that in other arenas. One more thing that I'd like to highlight in my last 30 seconds is the ETSU Office of Continuing Medical Education Project ECHO. In terms of telemedicine, we know that a large issue is accessibility to the stuff that it takes to run that program, right? The computer, the cart, if you're still using the cart for telemedicine. And what we've done with Project ECHO, which comes out of the University of New Mexico, is we've established an education program for pediatrics to allow rural providers that do not have access to pediatric specialists a gateway to ask for assistance and learn from those other healthcare providers how to better treat their patients in rural areas. It has been extremely successful. We present about 15 cases a month across the nation, predominantly in eastern Tennessee, however. In conclusion, moving forward, I would like to point out that our challenges are steeped predominantly in race and stereotypes in Appalachia. We are uneducated hillbillies, right? And breaking that stereotype is, I wish I could say it's getting easier. Unfortunately, we have a large uphill battle in terms of those stereotypes, but self-determinism wavers in the face of activism and change. And we believe that in order to have an empowered Appalachia, we have to first empower the individuals. Thank you so much. I'd like to ask Dolores Roybal to come up for our last presentation.